Marijuana kills brain cells.
I thought the same thing. I didn't start smoking pot until about 5 years ago. I thought pot made you stupid. I bought into it just as much as anybody did. I realized when I was like 30 years old that I was tricked. I was like, you gotta be fucking kidding me.
1974, the Heath-Tulin study. Ronald Reagan announces, the most reliable scientific sources say permanent brain damage is one of the inevitable results of the use of marijuana. Monkeys pumped full of marijuana, apparently 30 joints a day, had begun to atrophy and die after 90 days. Brain damage was determined after counting the dead brain cells of both monkeys who had been subjected to the marijuana and ones who had not. This study became the foundation of the government, and other special interest groups claim that marijuana kills brain cells. Here's what they didn't tell you. After 6 years of requests, how the study was conducted was finally revealed. Instead of administering 30 joints a day for 1 year, Dr. Heath used a method of pumping 63 Colombian-strength joints through a gas mask within 5 minutes over 3 months.
They suffocated the monkeys. What they did is they put these gas masks basically on their face and they pumped pot into it, but without additional oxygen. So after X amount of time, the brain shut down. Well, if you suffocate, the first thing that's going to happen is your brain cells are going to die with lack of oxygen. So what they did is they suffocated the monkey, showed all these dead brain cells, and then went on to associate it by saying that cannabis use causes your brain cells to die. And how many people, not knowing the origin of the study, have gone on to quote it and re-quote it. And now people believe it.
Studies since have shown no signs of any brain cell damage. In 2005, new research suggested that marijuana could possibly stimulate brain cell growth. That study hasn't received the same attention. Another common belief? Marijuana causes lung cancer.
In the 1999 study by the Institute of Medicine that was paid for by the United States government, they had to use words like may and should cause cancer.
We've been hearing for years them trying to say that it causes lung cancer, and we say, really, that's interesting because you can't even show us one case of cancer being caused by cannabis use alone.
You definitely have to do it moderately because it does paralyze the cilia, but if it's not radioactive, you're probably not going to get cancer from it.
Smoking can be harmful because of the properties of smoke.
Not as a result of anything in the cannabis plant, but because they're intaking heated plant matter into their lungs.
People said, well, you don't know, we haven't been smoking it long enough. Look what happened with cigarettes. We've had about 4 decades, or more than 4 decades of experience. If this was going to show up, it should have shown up by now.
Finally, a study came out just in the last month verifying that cannabis smoke does not cause cancer. It's different than nicotine. And the elements in the tobacco smoke do cause cancer, and the elements in the marijuana don't.
There's no cases of marijuana-only smokers getting brown lung syndrome. There's no cases of marijuana-only smokers getting emphysema. Strange for a plant that's so dangerous. How come none of that?
Marijuana is as bad for you or worse than tobacco? Impossible. If they had the evidence, they'd be putting emaciated bodies or emphysema, lung cancer, black lungs, they would be parading them throughout the media. They don't have one. Yet people somehow or other think that it might cause the same thing.
In fact, if you look at the straight deaths from substances, a different type of picture starts to appear. The #1 killer in the country? It beat out AIDS, heroin, crack, cocaine, alcohol, car accidents, fire, and murder combined. Tobacco.
That's a nasty, dirty thing to say, son. A lovely, pure white cigarette causing cancer. It gets me right here.
With an average of 430,000 deaths per year, considering it's a #1 killer, it's interesting to know that tobacco receives government subsidies and is grown with radioactive fertilizer.
Now get out there and sell cigarettes!
#2 on the list? If we don't include poor diet and physical inactivity, with well over 85,000 deaths a year, alcohol. As we look much further down the list, there are others that may surprise you. Caffeine comes in with 1 to 10,000 deaths a year. And some of our most popular pain relievers, non-steroidal anti-inflammatory drugs such as aspirin, still make an appearance with over 7,500 deaths annually. Where does marijuana lie in this? What kind of staggering number do we find?
I don't know, 50,000?
250,000?
300,000? For marijuana, I'd probably say then 80,000.
I would say it would be hundreds of billions.
Get ready for it. Here it comes.
There are no deaths from cannabis use anywhere. You can't find one.
In 10,000 years of known use of marijuana, there's never been a single death attributed to marijuana. There's 400,000 deaths in America alone every year that are directly attributed to tobacco.
I've heard that you have to smoke something like 15,000 joints in 20 minutes to get a toxic amount of delta-9 tetrahydrocannabinol. I challenge anybody to do that.
And even in the animal studies where people have loaded the animals up with doses that would be hundreds of times what a human could possibly be exposed to, no, the animals don't die. The LD50 seems to be astronomical.
I mean, you can die from ingesting too much aspirin. You can die from ingesting too much coffee.
The drug warriors who say we have to protect society, save these people, are being just a little bit disingenuous.
Not one university or medical facility has ever had a single death directly attributed to marijuana. But never mind that. There's other problems, other reasons to fear it. Take addiction, for example. There are more kids in addiction clinics for marijuana than any other substance. This must mean that marijuana is the most addictive substance today.
It's undoubtedly true that there are more teenagers and kids in treatment for marijuana than all the other drugs combined. What the DEA never tells you is why that's true.
A kid is caught possessing or smoking marijuana. He's taken to court. He's given a choice. Either you some horrible penalty, or you go to a treatment center. Obviously chooses to go to treatment, and goes to treatment there, he's considered an addict.
But then the DEA gets to point to that stat and say, look at all these kids in treatment for marijuana. God, it must be because today's marijuana is not the marijuana that your parents were smoking.
As far as I understand, only 3% of the people in treatment for marijuana are there voluntarily. The other 97% were told to by their guardian or told to by a judge. So you can choose between jail or treatment. And a lot of people choose treatment.
It provides no basis for speaking about addiction. Anybody who is at all sophisticated about marijuana would rate them the way two researchers were asked to rate drugs in order of addiction. Nicotine was 1, alcohol was 2, then heroin, then cocaine, then coffee, and then marijuana. There may have been a couple of other drugs, but marijuana was at the very bottom, below coffee.
This narcotic, unlike the opiates, the synthetics, and cocaine, is non-addictive.
What do you mean by non-addictive?
By non-addictive, it is meant that the user of marijuana, when deprived of the drug, will not experience the agonies of withdrawal. It is habituating, but its use can be discontinued.
Then what is its danger?
It's used.
So many people working for corporations that they lose their humanity.
So those are potential customers for these pharmaceutical companies that are not there if they're using a natural plant.
It's unlimited. You grow more, you get more medicine. Pharmaceutical companies don't want you growing your own medicine.
The government supported a small drug company by the name of Unimed to take a synthetic THC, tetrahydrocannabinol, and to put it into capsules to be used as a oral medicine. This became Marinol. This THC in Marinol is exactly the same 21 carbon molecule that's in herbal marijuana.
But it's not the same as medical marijuana. It's not a crude mixture of things, and there's no guarantee that you get the same results.
You can make a synthetic delta-9 tetrahydrocannabinol in a test tube. It'll have exactly the same number of atoms and the same arrangement. But how in the test tube can you put the electron spins together, the subatomic quirks and quarks, if you like, of that compound in the same way that a biological enzyme system will put it together? It can't happen.
In the case of a synthetic compound, if it's only an ingredient from the cannabis, they can formulate that as a drug and make a lot more money out of it.
We're confused that if, you keep hearing that there's no scientific proof to medicinal benefits of marijuana, why are there drugs like Marinol on the market?
Why do they even exist?
Well, that's part of this double talk about it. If we take and change it a little bit, so you believe it isn't marijuana, then it's okay. It's a great medicine.
They're trying to make marijuana into medicine because It is medicine.
Why did the government actually grow marijuana? I mean, the government has had marijuana programs that existed since the 70s.
It's impossible for me to believe that the government even believes their own propaganda. What I do believe is this, that you can fool some of the people some of the time, and they're doing an excellent job of that.
And for all the claims of these drugs being a more viable medicine because there's no high, we check some of the side effects. For Marinol, dizziness, feelings of exaggerated happiness, drowsiness. Last time I checked, those were signs of getting high. If it is indeed side effects of marijuana that are preventing the pharmaceutical world from accepting marijuana as a viable medicine, then they better start paying more attention to the products they've been marketing for years. Every year, prescription medicines kill over 100,000 people.
The pharmaceutical industry has been excellent at convincing the public that they need their potions. If you watch any kind of commercial for drugs, they're always using the third person. For example, where does a headache come from? It comes from out there somewhere.
Don't sell the steak, sell the sizzle.
How many people in this country alone are addicted to antidepressants? How many people who are on antidepressants really have imbalances, and how many of them just got off of a bad relationship and they're depressed?
It seems to be acceptable to give people something as long as you're wearing a white smock or you've given them a legal prescription. Doesn't matter how deadly the particular drug might be in terms of side effects.
What we call modern medicine is actually alternative medicine because it's highly experimental, it's often dangerous, often toxic, and it kills a lot of people.